Today's Wednesday Wisdom is going to be part 3 of our Essential 8 stretching series. So this is looking at muscles that tend to be particularly short and tight and the conditions that they'll contribute to. So we're going to take a look at 2 really important muscles for low back pain here. We're going to look at how to stretch psoas really effectively and a really interesting modification on our stretch for multifidus. Be sure to watch till the end. Psoas is probably one of our most important hip flexors, prone to being short and tight, and when it is, it can really compress the lumbar spine and add an awful lot to lower back pain issues. So like TFL, I'm going to be lying on my side. I'm going to pull the knee up so that I'm protecting my low back and I'm protecting my pelvis. I'm going to take a hold of the foot, but this time instead of pushing the knee towards the floor, I'm going to reach back. 1, 2, and relax. Now, if you feel this more in your thigh, that's okay. It just means your rectus femoris, the hip flexor that's part of our quads, is a little bit tighter than psoas. Changing the angle of the leg can help, so if I bring my knee a little bit higher, I tend to get psoas a little bit more. Think about the thigh as acting like an arrow pointing towards the spine. If it's pointing towards your lumbar spine, you're really getting psoas a bit more directly. So again, when we reach back, we're holding for 2 seconds, and then we relax, and we just do 10 repetitions. So let's try that again on the other side. I'll change ends so you guys get a different camera angle. So lying on my side, I'm going to pull the knee up towards my chest, reach back, take a hold of the foot, and like our TFL stretch, we would say if you're getting pain in your knee, you could put a roll towel in. If you're finding the movement, the range difficult, you could use a stretch rope around the foot, which takes some of that bend out of the knee. Pull the lower leg up towards your chest. Then with the top leg, we're going to reach back as far as is comfortable and relax. Reaching back, holding for 2 seconds, and relax. So each time we reach back and hold for 2 seconds, that counts as 1 repetition or 1 rep. If I'm not feeling that so much into the pelvis, if I'm feeling it more down into the thigh, I can lift the leg a little bit higher, which makes it more of a psoas stretch. As the knee comes down closer to the floor, we change amongst the different hip flexors. So at this kind of elevated position of the knee, it's more directly targeting psoas. And that's our final 10th rep. Excellent. Let's move on. Multifidus is a small but really important deep muscle in the back. It sits in the lamina groove, which is the part of the bone between the transverse processes of our vertebrae that sticks out to the side and the spinous process that sticks out to the back. So we have a band of muscle going down each side of the spine, and this is a 4th layer muscle. It's quite deep. The reason it's so important is because it connects one vertebrae to another, and it involves or controls small movement between those vertebrae. When it gets short, tight, and dysfunctional, it can oftentimes start to lock down vertebral segments, causing facet joint dysfunction. So for this stretch, we're going to do a combination of flexion and rotation. If you don't find it comfortable to sit on the floor like this, you could equally perform this exercise in a chair. But this is a nice transition from some of our other stretches. So Ali, what we're going to get you to do is you're going to flex forward and rotate. So you're going to lean forward as far as is comfortable, and then we're going to position the hands. Let's get you turning towards your right side first. So you're going to put your right palm on top of your thigh. This is going to help push to rotate. This hand, the lower arm, is going to grip on the lower leg, which is going to help Ali to twist. So you're going to turn the shoulders as far as is comfortable. 1, 2, and ease back. Twist, 3, 4, and ease back. Now, if you count reps for me, Ali, you're going to count up to 10. So again, my habit is to count in 2s because I'm counting seconds, but you can equally just count the number of times you perform the exercise. Now, the more you flex forward, the further down the back you're going to feel this. So you can really tailor this exercise to suit yourself. If you feel this more in the shoulders, round your upper back and drop your head, but keep your lower back more vertical. Do the same twisting motion, and that will get this part of the back. If you want to get more into the mid or the lower back, you simply lean forward further to target each of those positions. Good. How are we doing on reps, Ali?
Good.
It's about 10 there?
Yeah.
Okay, let's do the other side. So straightening back up for a moment. We want to think about, if we want to get more of the upper back, you're going to tilt your head forward and just roll your shoulders a little bit to there. Good. I think Alison probably needs this a little further down the back, so we get you to roll forward a little bit more, coming into mid and slightly lower back. Again, this hand is going to grip the lower leg. This one is on top of the thigh, and you're going to rotate your shoulders. 1, 2, and relax. Good. Twisting. 3, 4. And remember, it's an active movement, The hands are only acting as an assist. It's a gentle pressure. It's actually the muscles of the torso that are doing most of the movement. When we activate the muscles in the back, we inhibit the target muscle and get it to relax. So we're really helping multifidus to lengthen and stretch because the nervous system is telling it to relax. That process, as we've said before, is called reciprocal inhibition. As one muscle is contracting, the opposing muscle must relax. That's good. So counting up to 10 repetitions, rotating as much as we can, twist, good. Oftentimes as a therapist, we can assist with these stretches. We're not forcing the client, we're just enabling them to go a little bit deeper where maybe the muscle that's doing the action isn't quite strong enough to overcome the muscle we're trying to stretch. Good, that's great. Thanks, Ali. So if you're a back pain sufferer, really practice those stretches. We've got a longer video on YouTube that really talks you through it. It's a whole follow along, so check that out. We'll put a link in the description. Thanks for watching. We'll see you guys again soon.